Hello, everyone. Dr. Merkle here. It's great to be with you. Today is actually July 3rd. Tomorrow's a big national holiday celebration. But I got to tell you, I wanted to update you a little bit on a case that I talked about before. This 60, I think she's 64-year-old female who was diagnosed with lung cancer in January of this year. But she was diagnosed, the lung cancer she was diagnosed came from her kidneys. And she had had kidney cancer several years ago. Obviously, it came back and now metastasized to her lungs to stage 4. And it was very advanced when it was diagnosed. And it was positive with biopsy. And so they wanted to do chemo and radiation, all this stuff, surgery. And she declined. She came to me for a second opinion, and we've been treating her since January, and I can show you her test results. But in May of this year, her numbers were going the wrong way. Originally in January, we saw her, and we saw nice improvement. You can go back to a previous blog on that to see where it was, and we saw nice improvement. And a couple tests, good improvement, and then she slacked off. And in May, we see her numbers hit the all-time high of 285 for the LDH. Her CK went up, her ferritin went up, and we can also see her red blood count, hemoglobin hematocrit, had gone up, and her CA125. Now, the LDH and CA125 are positive for various cancers. LDH can be positive for many types of cancers, but this indicates cancer. And the red blood count, hemoglobin hematocrit, because it is a kidney cancer, kidney cells produce erythropoietin, which stimulates the bone marrow to produce red blood cells. Well, that's what's happening. The red blood cells are going up, hemoglobin hematocrit, because the cancer cells were growing. And so now I expect that part to be a little slower in responding. But you can see here from May 21st, 2019, this is where she was. And then in June, we tested just a few days ago, we tested her again, and these are her test results. And I was really thrilled to see her LDH drop from 285 to 251. Very nice progress. The hematocrit dropped, and the CA125 also dropped. So those are really good test results in just a few weeks. Really good. Now I'm just going to zip down here and you can see where the numbers were. Here's the dates. You can see where they were earlier. LDH is up to 315, then went down to 254, 235, went up a little bit, 258. And then by May, it had shot up to 285. Definitely going in the wrong direction. And it is great that it's going down now. So hopefully this is encouraging to you. I'm excited about it. This is a great July 3rd present for this patient, but it's a reflection of what she's doing. So again, it's stage 4 cancer. She'd probably have at most 6 months to live. And this is July 4th, diagnosed in January. She's on the right track and feeling good. She has a little cough to be expected, and I'm expecting these numbers. I'm actually wrote these numbers are coming down good, and I would actually expect the red blood count, hemoglobin hematocrit to come down, to be a little slower in coming down as the bone marrow is stimulated less and less. So that will come down in time, but the main things are LDH dropped, CK dropped, and CA125 dropped. So hopefully you like these little case tips, and if you are having cancers, things like that, maybe there's something you can do to get your body healthier. We did not treat this lady's cancer. What we did, we got her body healthier so her body can do what it already knows how to do, and that is fight cancer. So I'm Dr. Merkle. I'm the developer and inventor of science-based nutrition. I've trained doctors all over the country, and we would love to help you with your health problems too. Have a great day and a great July 4th. I'm Dr. Merkle.